Hello everyone, welcome to Raaonline. I'm Dr. Abhinaya, I'm a consultant pediatrician. So in the Nelson series under the chapter of nephrology, the next topic of discussion is on renal transplantation. So there are many indications for renal transplantation, ultimately culminating to what is called as an end-stage renal disease. So what is an end-stage renal disease? It is defined as an irreversible decline in the renal function. So when our estimated GFR is less than 15 ml per minute per 1.73 meter square. So this is end-stage renal disease. So the predominant and the most important indication will be end-stage renal disease. Renal transplantation will serve as the therapeutic option for end-stage renal disease, and we have both cadaveric donors and live donors, and the good thing is pediatric patients have a better graft survival when compared to adults and especially with live donors. And most often the renal transplantation that is done globally is done most often in this age group, that is between 11 to 16 years when it comes to the pediatric age group, and this constitute more than 50% of the pediatric end-stage renal disease. Nowadays usage of cadaveric donors has reduced, so few transplants only with cadaveric donors. So indications for renal transplantation is end-stage renal disease, and congenital and hereditary diseases are the most common causes of this end-stage renal disease requiring renal transplantation. So very young recipients, that is less than 5-year-old, it is most often a urinary tract malformation or a hypoplastic obstructive uropathy. Whereas older age children, that is after 5 years, or the typical age group where renal transplantation is done, that is between 11 to 16 years, glomerular diseases become the major cause of end-stage renal disease, and particularly focal segmental glomerular sclerosis is the most common cause of end-stage renal disease which requires renal transplant. So we have talked about the indications. When we are listing for a pediatric renal transplant, a standard preparation protocol is there. So for a recipient, we have done the history, physical examination, we have diagnosed. Before listing, we have to do all these investigations. So starting from the basic investigations like hematology, CBC, platelets, differential counts, coagulation parameters, that is PT, INR, biochemistry, the complete biochemistry, and immunology, especially ABO blood typing, HLA typing, histocompatibility matching, tissue cross match should be done, virology should be done before the renal transplant, and radiography, especially of X-ray, bone age, and MCU. MCU has to be done before a transplantation procedure, and a holistic consultation involving a pediatric surgeon, dietitian, social worker, etc. has to be taken. So renal transplant requires immunocompromised state. So prior to the renal transplant, all the necessary vaccines, age appropriate vaccines, has to be given for the child. Hepatitis B has to be given double dose, and live vaccines like MMR, varicella has to be given prior to initiation of the immunosuppression therapy. Chest X-ray and MANTO is also warranted.